Hi everyone, Corey Goldberg here. I often get asked by my facelift patients about other procedures and things that can be done in conjunction with a facelift. So with a facelift, I will often do eyelid rejuvenation called blepharoplasty, and this can be eyelid surgery for the lower or the upper or both. Sometimes I'll do brow lifts, which includes the eyebrows and the forehead, which can be done open or can be done through a minimally invasive endoscopic technique. Sometimes, and those are rejuvenation procedures, sometimes there's other facial balancing procedures that I'll recommend at the same time or patients will inquire about at the same time as a facelift. And that can include things like a rhinoplasty if someone has a very center-heavy face. Also genioplasty or chin advancement can be very useful for some patients. A weak chin often results in a lot of looseness along the neck and the jawline. Giving proper projection to the chin can be a part of addressing some of the issues people see in the neck and lower face. Those are surgical procedures that can be combined and done at the same time as a facelift. Sometimes these things can also be done separately. They don't all have to be done at the same time. The decision to do that is a personal one and up to you to decide whether it's worth getting it all done at once and just having one recovery or spacing it out over time, but then needing more than one recovery to get through the series. After a facelift, there's lots of other procedures that are useful. It's important to consider your skin, things like laser treatment and phototherapy. Skin treatment is super important. A facelift can be done really, really well, but if the skin on the surface hasn't been treated, the facelift result is compromised. Important to think of the skin as being the canvas of the face, and so certainly it's really important to deal with that as well. Also with a facelift, during or after, sometimes there's a need for volume or other things like reducing muscle movement, and so things like neuromodulator treatment with Dysport, Botox, or other injectables such as fillers are important things to add on to a facelift and also to help maintain it over time. So there's lots of surgical and non-surgical things that can be paired with facelift depending on your needs. Really important to discuss this with your surgeon and identify what are the right procedures and maintenance procedures for you to tailor to your specific goals. Corey Goldberg, wishing you all the best, and I hope to see you soon.